Welcome, everyone. Thank you so much for joining us for today's webinar, Exploring Financial Supports for People with Disabilities. It is a jam-packed session today. We have 5 expert speakers joining us today from Prosper Canada, Disability Without Poverty, and even one presenter from our very own PH community. So without further ado, I'll just introduce our first set of speakers and we'll get started. So today we have from Prosper Canada, David Ike and Janet Flynn. David is a Senior Program Officer at Prosper Canada in the Program Delivery and Integration Department. David focuses on technology-enabled financial empowerment solutions, including the Benefits Wayfinder. Janet Flynn is a Senior Program Officer in Prosper Canada's Program Delivery and Integration Department. Janet works with community partners to embed financial empowerment initiatives into their existing services. Janet has been closely involved in the development of the Benefits Wayfinder and the Disability Benefits Compass, things we'll hear all about today. So without further ado, I'll pass it over to Janet and David.
Fantastic. Thank you so much, Kimberly. And thank you, everybody, for joining us today. We're really happy to be able to share some tools that we hope will be beneficial for yourselves and for others that you support in accessing benefits. So just first, I'll just tell you very quickly about Prosper Canada, in case you haven't heard about us. We're founded in 1986, and we're a national charity dedicated to expanding economic opportunity for Canadians living in poverty. And as Canada's leading financial empowerment champion, we work with partners in all sectors to ensure that Canadians, regardless of what their income might be, have access to financial programs, products, services, and advice that they would need to be able to build their financial well-being. So for today's session, we're hoping to help you understand what the Benefits Wayfinder and what the Disability Benefit Compass is all about, how you can use it to help someone find benefits, how to learn how to apply for benefits, and also to get help if needed. And we're hoping at the end that you'll be able to be equipped to use these tools and also to share them with those who you think might be able to benefit from them the best. So just to give you a little bit of context on why these 2 tools were created, there's a lot of missed income every year. So there's billions of dollars in benefits that go unclaimed each year. And so those who really need it, those most impacted by the pandemic and those who are living on low incomes are not getting these benefits which they are eligible for. And there's lots of complex processes. So as you probably are aware, a lot of the benefits application processes are not exactly the easiest. They can be quite challenging, especially for people living with a disability as well, or multiple disabilities. And there's also a need for frontline staff to also understand what benefits are out there that they can introduce to clients, as well as just educating themselves and then using it as a tool if they're working with somebody. So I'm going to tell you just a very quick description of the Benefit Wayfinder, because David's going to take you through an online demo to describe it in more detail and show you the features. So the tool was launched publicly in 2022, January, and it was made to be simple, have very intuitive navigation. It can be used as a virtual guide for people helping other people with disabilities. And most importantly, it's written in plain language. And it has benefits that people may be eligible to receive. So when you see the list, they may not be eligible, but they can go through it to see if they are. It has federal, provincial, and territorial and government benefits and information. And really the key is that it's a one-stop shop. So you don't have to go to multiple web pages to try to find different benefits. It's all in one place. And again, it can be used by clients individually, or it can also be used by those who might be supporting people to understand and see what kind of benefits are available. And I'd just like to thank our sponsors who funded generously this tool, the TD Bank, and also our Maple Leaf Feed Opportunity. So I'm going to invite David to share his screen with the Benefit Wayfinder. And as he does that, I'm just going to walk you through a persona that we're going to use to demonstrate the features of the tool. So David, if you'd like to, I'll stop sharing if you'd like to bring up yours, and then I'll just talk as you're doing that and introduce you to Kelvin.
Okay.
So
I'll share my screen now. Okay, go on,
yes,
Janet.
yeah. So Calvin, he lives in Ontario and he's 63 years of age and he's married. He was recently diagnosed with pulmonary hypertension. He's a father of 2 adult children who live on their own, and he is a Canadian citizen. Just recently, he retired, and the entire household income is just under $60,000 per year. He is up to date in filing his taxes, but he's wondering if he's receiving all the benefits for which he may be eligible. So we're going to introduce the tool now, David, and he'll describe how Calvin and his partner and or anybody else can help him see what's out there. But over to you, David.
Yeah, thank you, Janet. Can you see my screen?
Yes, perfect.
Awesome. Yeah. So very quickly, I'll introduce the benefit wayfinder. So Janet has also introduced the tool, a high level introduction of the tool. So for the sake of time, I'll go straight and explain how you can use the tool. The tool can be used in at least 4 different ways. The objective of the tool, like Janet said, is for us to be able to find benefits that we are likely eligible to. In Canada, a lot of benefits, up to 1.7 billion worth of benefits, are left unclaimed each year. So the objective of this tool is to help people increase their awareness as to what benefits they might be eligible to. So the way the tool works is you can use the tool by coming to the benefit wayfinder, and then on here you see the starting point. If you click on the starting point, you see the different situations or transitions that somebody might be going through, and you select which one that best resonates with you. Or you can use the benefit wayfinder using the questionnaire. The questionnaire has a set of questions that helps people understand different questions that help us generate benefits that will relate to those questions that are answered by people using the tool. Then also you can also use the benefit wayfinder using the browse all benefits, meaning if for instance you want to check what benefits that are available to you, you can use you can just come on here and check what the benefits are that are eligible to you. One step I jumped is that when you come on the benefit wayfinder, you come on here to the top right and select what province you're browsing from. So the personnel we'll be using today is from Ontario, so we've selected Ontario. This is super fast. So so there are different ways to check the benefits that are open to you. I said the starting point, the questionnaire, you browse all benefits. Then on the starting point, there's also there are different ways to find out what's best for you. But the best one that we like to use is the questionnaire, and Janet and I will go through the questionnaire right now using the questionnaire that Janet mentioned earlier. So Janet, are you ready to walk through the questionnaire with me?
Yes, I'm ready, David.
Okay. So one sec. Okay. So is he up to date with his taxes?
Yes,
Okay.
Calvin's up to date.
Okay, thank you. Yes. Next. How old is Kelvin?
He's 63 years old.
Okay, between 63 and next. What is Kelvin's citizenship in Canada?
He's a Canadian citizen.
Okay, Canadian citizen. The next. Is Kelvin working, or where's the source of his income?
He just recently retired.
All right, thank you, Janet. How much does everyone in Kelvin's household make?
Just under 60,000.
Just under 60,000. including Kelvin, and how many people are in his household or in his
Just
home?
it's just Calvin and his partner. Two.
Okay, two of them. Right, thank you. Is Kelvin caring for any child below the age of 18?
No, both his children are over 18 and they live on their
No.
own.
Okay, thank you, Janet. Is Kelvin or anyone in his household living with a disability?
Yes, Calvin has recently been diagnosed with pulmonary hypertension. So yes.
Okay, thank you. Where does Kelvin live? Is he renting or his social housing, or owns his own home?
They own their home.
They own, right? Is Kelvin expecting a child by any chance through
No.
his partner or something? No.
No.
Okay. Since the age of 18, how long has Kelvin lived in Canada?
He's been over 20 years.
Over 20 years. Okay, more than 20 years, right? Is Kelvin or his spouse a Canadian veteran?
No.
No. Okay. Did Kelvin's spouse or his parents live in Canada and pass away?
No.
No, right. So you see, we have answered all the questions, and now we have the opportunity to review our answers and then submit. So you see, based on the questions that Kelvin has answered, we have 18 benefits that have been recommended to him. So we go to the dashboard. On the dashboard, we see all the benefits that have been recommended. For instance, and each benefit has a mini landing page. So for instance, so you see these are all the benefits, 18 of them. So Kevin will take his time and look at them and see which ones that are best for him. So each benefit has a landing page. On the landing page, you see what the benefit is. Okay, then you can go into it. So you see, this is registered disability savings plan. There's an introduction to each benefit. Then important, there is a link to the source page where we got the benefit from, where Kelvin can go and then apply. Then also there's the eligibility. What are the eligibility that Kelvin needs to meet to be able to apply? And very importantly, there's also on the on each benefit how Kelvin can apply. So we go back. So you see, it's 18 benefits. Definitely, Kevin might not be able to look at all the benefits in one go. So as the person who's supporting Kelvin, Kelvin can either print out the benefits, in PDF on here, or he can save them, save the URL by putting the email. Like for instance, I'll put in my email and then send it to myself, and you would see this link will be sent to my email, and subsequently, anytime so you can send it to Kelvin and also send to yourself as the person supporting Kelvin. And anytime Kelvin comes once, he can use the URL and come back to this site and see all the benefits that they need, that he has qualified to, or he might be eligible for. Then also, if Kelvin needs help, on here we have our help center. So because Kelvin lives in Ontario, we have a list of agencies in Ontario. These are agencies, and all the agencies you see here, they are free agencies that Kelvin can approach for any service, any assistance he needs in completing the forms. And also we have the agency portal. So as an agency that is supporting people like Kelvin, you can also get more resources here. We have the we have the Benefit Wayfinder webinar, a webinar similar to what we have today. It's in English and French. You can always come here and look at it again. Then we have other resources like let me see, we have resources that you can use to support your client. This is like a take action template where people like Kelvin can document how they want to apply for benefits. Then we have other tools like guide to key benefits. For each province there are key benefits that that people are eligible for, so this link takes you to a resource where you can see, as per your province, what key benefits that you can be eligible for. Then also you can help us share this tool by using this link and share with your network. Yeah, I'd advise you come back here and look at it again, because this demo was really fast. So if you want to look at get a similar demo and see how the tool works more, you can come on here. We have it in English and French, and you can also have a revise of what we have done today. For now, I will leave it and pass it back to Janet. Thank you, Janet.
Great, thank you, David.
Yeah.
So what I'm going to take you through now, I'm going to share my screen, is if you can stop sharing your screen, David, and then I'll share mine.
Yes, I'll stop sharing now. 1 minute, let me stop.
And what I'm going to be taking you through is the companion tool that was just launched last year specifically for the key disability benefits. So as we mentioned earlier, disability benefits are among the most difficult to get because they have many steps involved. They have many forms need to be completed by specific medical practitioners. And also to someone who might be trying to do it on their own, it might be very daunting and re-traumatizing. So David, can you see my screen okay with the disability benefit compass?
Very well, Janet.
Perfect, thank you. So similar to the compass, this one here has the benefits for all provinces and territories in Canada. It's available in English and French, and also it's been fully reviewed from an accessibility perspective. So one of the features that was asked for by the people with disabilities that helped design the tool was to have light and dark mode as a preference. The 4 key disability benefits I mentioned are ones that were deemed by our partners that we work with in British Columbia to design this tool with people with disabilities, were whatever the key or the main provincial or territorial disability assistance program was. So in this case, in Ontario, it's the Ontario Disability Support Program. And then the Canada Pension Plan Disability Benefit, the Disability Tax Credit, and the Registered Disability Savings Plan. So sort of at a minimum, these are ones that, those who work with people with disabilities say at a minimum should be aware of and assess whether they're eligible for them. I'm going to take you through the disability tax credit as an example to show you how this tool was designed. And this is really one that's really underutilized in Canada and is also a gateway. And what I mean by that is to get some other benefits, you need to have a disability tax credit certificate. So it's really an important one to first look at and review. So similar to the benefit wayfinder, there's a description of what this particular benefit is or certificate. And throughout we have blue boxes. And these blue boxes are going to flag some important information for people to look at before going any further. And as I mentioned, this was designed in a 3-year project that we worked with Disability Alliance BC and Plan Institute and our evaluator SRDC. And importantly, with quite a lot of people with disabilities throughout every stage of the process. And one of the things that came up quite often, which you're probably most aware of, is that one of the big stumbling blocks or barriers is people just not having a doctor or a doctor who feels comfortable making a diagnosis and filling out the forms to describe the impact to daily living. So this is a little important information right at the front, which will take people to where they can look for a doctor in their province and territory, since this is a big stumbling block for a lot of folks. Similar to the benefit wayfinder, we have for every one of the benefits in here, the introduction, eligibility, all the steps to apply, and very importantly, what happens after you apply. What came up a lot when we were working on this was a lot of people think that they're done when they're denied. They didn't realize that there's more steps you can take after being denied, and that you might even expect to be denied a few times before you do finally get approved. So it's not the end of the road. So this section I'll quickly show you in a bit describes what to do if you're approved and or if you're denied. Throughout, we have frequently asked questions, and they're consolidated here at the end, as well as all the resources. And what's different about this than what you might get when you go to the government site is that it has, and I'll show you here, each step as you go through, and this was one of the requirements that was very clearly defined to us, was to make it as simple and step-by-step as you can. At each step, we have frequently asked questions that those who've gone through this process have found to be, come up a lot with the answers. There's tips at each step of the way. And there's also challenges that people with disabilities identified at each step. What we've included them here and what to do if you encounter them, as well as resources. And I'll show you that. So as you can see here, it's very simple. So the very first step, do you have a form T2201 to fill out? If you say yes, you're going to continue on the steps to the end. If you say no, or I'm not sure, it's going to take you down and describe, what you need to do, where you need to go. All the links are live, and we do review both the Benefit Wayfinder and the Disability Benefit Compass twice a year to make sure it's up to date. And then it gets into any tips for sections to look out for. And again, as mentioned, frequently asked questions. So it's got value-added information from those who support people getting this particular DTC, as well as people with disabilities who have input to the development of this tool. Then you can go through step by step, but I'll also note that also if you continue down below, there's also resources that are partners, as well as any other resources we found or that they've worked on with other organizations to help people at each step. So the one I mentioned was how to find a doctor or nurse already, but this one's really important. How can you help your medical practitioner complete the DTC medical form? And this will link to a tool that was created by DABC and in partnership with some other organizations, which is, and again, everything in here in the Wayfinder are free. We don't put anything in here that it would cost you money to do. And this will take you through another tool, which will help at the end print out a form to give to your doctor that would help them fill out the form if they're not 100% comfortable with the impact to the daily living. So lots of help throughout, and similar to the Benefit Wayfinder, there's a little blue box at the bottom here that you click for help, and it'll take you for that province or territory, who to go to for help with whatever benefit it is that you're interested in. And then again, all the definitions that were deemed to be important to know about are consolidated in the glossary. And all the resources are consolidated from the entire website under here. And again, you can go, if say someone comes in here and they say, you know what, I've now applied for these and I've successfully received them. I don't really need any of these. What do I do now? Well, then they can go to view other benefits. And then this is where it links back to the tool that David just showed you, the Benefit Wayfinder. And it'll take you there, where you can then say, okay, are there any other disability benefits that might apply for me? You can go down to disability support and it'll list them. Or again, do it through the method that David just took you through. Do a customized search based on your own personal situation. So those are our two tools. And as David said, I know we've gone through them very quickly, but I believe you'll have access to the presentation, which has all the live links to the tools and the materials. And also at the very end, there's a contact email that's dedicated specifically for these tools that David and I monitor, and that we can get back and answer any questions that you might have. And again, if there's any organizations that you know of that you think would be good candidates to put under the help, where they might provide people with free advice or problem solving. This is not a cast in stone list. We're continually adding to this list as we hear about and vet the organizations who are interested in having themselves listed. So I think that's it, Kimberly. I think we'll pass it over to you now for our next speaker.
Okay, thank you so much, Janet and David. I think this is the third time I've seen your presentation, and every time I see it, I learn something new. So thank you for that. So without further ado, let's move on to our second speaker. Our next speaker is Frances Andrusiak. Some of you may recognize Frances, especially from our wonderful meetups. Frances was her husband Nick's care partner for 20 years. Currently, Frances faces her own personal health challenges as a person with CTEPH. Frances's concern has been for people who don't realize they are eligible for the disability tax credit and other tax benefits, or find the application process overwhelming. I think we hear this a lot. She shares her experience and offers support to individuals and families to understand how the tax credit criteria apply to them and how to work with their healthcare provider and the Canada Revenue Agency to obtain the benefits that they deserve. So Frances, I'll pass it over to you. I'll give you a second to get your slides ready.
Okay. Hello, everyone. I'm really pleased to be here, and thank you for asking me. You're going to find that a lot of what I'm talking about integrates so well with what Prosper Canada, Janet and David have brought to you. I started helping people with this more than 15 years ago when those resources and tools weren't available. And people simply didn't realize, and many still don't realize, that they might be eligible for this program. And so I'm going to give you some of my hints, but I think once you hear what I have to say, you'll probably quite happily use the very sophisticated tools that Prosper Canada has to offer. The question I'm going to try to answer for you today is, if I have pulmonary hypertension, am I eligible for the disability tax credit? And then I'm going to encourage you to apply. My experience, because pulmonary hypertension is more recent in my life, my experience has been with many other kinds of disability issues. Excuse me, I thought I had everything turned off. And I've, as Kimberly mentioned, I have had a lot of experience with people with Parkinson's and a lot of other issues. And I have not needed the application for myself for pulmonary hypertension because I already had a disability tax credit. So what is the disability tax credit? In addition to what Janice and David have said, I'm going to tell you that applying for any program or benefit is a little like playing a card game. You have to know the rules first. You don't have to be an expert on it, but you've got to have some sense of what the rules are. It's just like if you were playing a card game with your friends and somebody said, well, you know, we were playing another card game a week ago and I really liked that. Well, you just can't apply the rules that you were talking about now or trying to use now to that other card game. So the disability tax credit is a credit on your income tax. This tax credit has nothing to do with whether you are able to work or not. You could be working and still be eligible for the disability tax credit, but you have to apply to the Canada Revenue Agency before you claim the tax credit on your income tax. The disability tax credit reduces the income tax amount you have to pay. So it's not a salary. It is not a regular payment like the CPP disability plan. It is a reduction in your income taxes. And the amount of the benefit is not a set amount because it depends on income. The amount can't easily be predicted. And I will put in my promo for the fact that it's not really a fair tax, because the more income a person has, the more benefit they will get from it. However, unused disability tax credits can be transferred to a spouse if not, and some other people. in certain circumstances, if not all used on the taxpayer's income tax. So who is eligible for the disability tax credit? Well, it's not age dependent. It can involve both adults and children, and it's not limited to seniors, as you may think. So here are the rules, or the eligibility criteria, as benefit programs like to call them. Who is eligible for this aspect of the disability tax credit? Eligibility is based on what effect whatever someone has on certain functional aspects of their daily living. So it has nothing to do with work. It has to do with certain aspects of certain functional aspects of daily living. So you may have Parkinson's, arthritis, MS, dementia, mental health issue, a mental functioning issue, or pulmonary hypertension, etc. But what matters for the application is what effect these mostly chronic conditions have on some aspect of daily living. Today we are focusing on pulmonary hypertension. But the fact that you have pulmonary hypertension is not the significant thing that makes you eligible for the disability tax credit. It is how the pH affects some aspects of your daily living. So here's the list of eligible functions of daily living. Not all functions you'll see of daily living are on the list. You will notice that bathing, driving, grocery shopping, grass cutting, and snow clearing are not on the list. But the list includes speaking, walking, eliminating, that's bowel and bladder, feeding, dressing, mental functions, life-sustaining therapy, and vision and hearing only if things like hearing aids or glasses don't bring someone into a level of being able to function. So let's look at this from the list of eligible functions and pulmonary hypertension. There might be people that have experience with pulmonary hypertension affecting some of the functions that are outside of the ones I've marked off, but I've kind of tried to imagine from what I've been hearing from the groups I've attended, which ones are most likely affected. So I've talked about walking, feeding, dressing, perhaps mental functions, and life-sustaining therapy. So let's take, we've taken another look at the list in view of someone experiencing pulmonary hypertension. But I'm going to point you to the one called life-sustaining therapy. It's an interesting category. Qualification here is not based on whether you can or can't do something or how well you can do it, how much it's affected. The qualification is related to having to dedicate at least 14 hours per week, twice a week, to life-sustaining therapy, which includes oxygen supplementation. So if you are using oxygen daily, your application should be a simple matter of asking your physician or nurse practitioner to complete the form. You might be having an easy time of this application. If you are not using oxygen, the strategy of walking into the doctor's office with the form and asking for it to be completed doesn't generally work out as well for the rest of us who don't use oxygen. I will speak about this topic a little later. Otherwise, eligibility requires that one category on the list of functions is severely affected, or that at least two categories are less severely affected. And as I said, not every person with pulmonary hypertension experiences an issue with every functional category. Walking is most often affected in pH because the shortness of breath limits how far we can walk, causes fatigue, and it may even affect our gait. Now, this doesn't mean that the person can't walk, or that the person can't do some of these other tasks at all. It is a matter of degree of how one of these functions is affected. For example, for the walking impairment, the patient must not be able to walk 100 meters, that's about a city block, or it must take them an inordinate amount of time, 3 times longer than normal to do so. But as a person with PH or with arthritis or a lot of other functions being affected, dressing can be affected. Anybody who has difficulty walking often has difficulty dressing. Again, it doesn't mean that somebody needs to dress them. It's just that it takes longer to dress, and that there are challenges with certain parts, like bending down to put on your pants or socks and shoes and get on a jacket. You might be tired by the time you've done those things. And perhaps we can share how PH affects your life relative to the disability tax credit application next week when we meet for a round table. So there are some additional criteria for eligibility. The issue has to have been or is expected to last at least a year. So it's, if I break my leg and it heals within a year and it has no complications, I'm not eligible for this disability tax credit. But if I have some complications, that last more than a year, I may very well be. And as I've mentioned, one of the criteria is how severe the effects of whatever I have is. Now, I was thinking about like walking with a walker because of shortness of breath, or pulling an oxygen tank, an example of how walking may be affected. Eligibility may be met if one of these functions is severely limited, or by a combination of functions if they are less severely limited. The third criteria considers how frequently the effects occur. You and I know that PH doesn't take a holiday. So I'm gonna look at something that has to do with the date of diagnosis versus beginning symptoms. When I talk to people and they're telling me about whatever is happening to them, they often tell me the date of diagnosis first. And as far as CRA, Canada Revenue Agency, is concerned, they are willing to accept in many situations the beginning of symptoms. So you might have had PH for a lot of years, maybe didn't know about this program. And if you can show in some way that you had symptoms happening for some time, Canada Revenue Agency will accept generally the eligibility from the earliest symptoms that affected functioning. And you might be eligible for an amount for previous income tax years for up to 10 years if you are eligible. So the date of diagnosis is not a significant criteria as far as CRA is concerned. The date the functions were affected is more important. The healthcare professional doesn't have to have documentation of the beginning of symptoms in your health record. They are required to act from their professional knowledge. In the case of PH, they should know that symptoms generally didn't occur suddenly, but were more likely to creep up. So who decides if you are eligible? First of all, it's your decision to apply. However, the application must be completed by an appropriate healthcare professional. There are some situations in which an occupational therapist or a physiotherapist can, and that's listed in the application if they are able to fill out the form for you. But most commonly, this is completed by a physician. And here I'm in Manitoba. I have talked to specialists, and they refer the situation back to the family physician. So you usually start with the family physician. And in many situations, a nurse practitioner is also capable of filling out the form. A word about the form. While this is your decision to apply, it is the doctor or healthcare professional who fills out the detail of how your situation fits into the criteria. But you should never take an answer from a healthcare professional that you are not eligible. It is not their decision to make. I'm going to say that again. It's not their decision to make. In the long run, whether you are or are not eligible is the decision of the Canada Revenue Agency. By the way, the healthcare professional may charge for filling out the form because it can be a complicated issue. Get a receipt for income tax purposes. And I had a wonderful experience yesterday meeting with a group of friends. And one of them started telling us her story of applying for a disability tax credit. She went to her doctor who said his fee would be, I think it was $140. And this feisty lady negotiated him down $20 at a negotiation until she got to $20 for the fee. I'd never heard of that before, but she managed to make it work. Okay, so CRA, Canada Revenue Agency, can make one of 4 decisions when you've applied. They can say no. They can give you a temporary eligibility, which is usually for 3 years. They can send a letter saying, with a category I call, don't call us, we'll call you, or it can be made permanent. Permanent is the most likely with a PH history. But what do you do when the answer is no? Well, first of all, as Janet was mentioning, you reapply. There's a long way before you get to appealing a decision. You can reapply. My husband applied 3 times. They kept moving the goalposts in those early days of this program. So how do you avoid the no? This is really important because none of us like to be turned down. So how do we do this? Gather detailed information relevant to the application. A good application providing appropriate information is the way to avoid no. You will be having a physician, usually, or a nurse practitioner or other healthcare professional fill out the form. And there may be many things about your situation in your daily functioning that they do not know. And sometimes they're not qualified to make an assessment on that particular issue. So here is how to avoid no. When you've done your homework, you've got it ready, and you have the detailed information relevant to those functional categories, then make an appointment with your doctor or healthcare professional only to discuss this application. Don't piggyback it with other topics. Take someone with you if you can, and give the healthcare professional a couple of major points, and then leave what you have written with them. It doesn't have to be a formal presentation. It could be a points on a napkin with crayon, but something to leave with the doctor. Appreciate that the doctor may be filling out the form after having had an office full of patients all day and is probably tired and hungry, or perhaps is doing it 2 weeks later, trying to remember what you talked about. So be compassionate to your physician or healthcare professional. And then when you get the application, make sure you get a copy of it. The best way to submit the form to the Canada Revenue Agency is by uploading it to your personal CRA account if you have access to it. Or you can ask your accountant or tax preparer to submit the form for you. At this point, mailing a paper copy gets a very slow response from CRA. The doctor may offer to submit the application for you. This isn't my preference. You should review the form before it is submitted. This allows for catching any problems at this stage of the application. I hope this gives you a sense of that you can apply, and frankly, my my experience has been that communication with your doctor or healthcare professional is the most important part of this process. Because unlike the CPP disability form, which has a section for the client patient to fill out and the doctor to fill out separately, this relies entirely on the doctor. I have a few last words. First of all, avoid commercial companies offering to help you with the application for a fee or a percentage of the take. The federal government has promised to limit the fees these companies can charge. Passage of regulations were met by a court injunction preventing the implementation of the regulations. The activities of these companies has been described as a cottage industry preying on people with disabilities. CRA's response, meanwhile, has been to set up many online resources to help people understand the program and help people submit their own disability tax credit applications. And of course, this wonderful set of tools that Prosper Canada offers. In my experience, the clue to a successful application, I'm going to say this again, is providing the doctor or healthcare professional the details of how pulmonary hypertension has affected your life relative to the eligibility criteria outlined by the disability tax credit application. I hope I've encouraged you to apply for the disability tax credit. It can be very worthwhile, and while it doesn't solve our health issues, it can be a valuable support. I'm going to mention a couple of other tax credits that we don't have time to deal with in detail, but you'll find them again on the Prosper Canada website. One of the, and I'm in Manitoba, so one of the Manitoba credits available to Manitobans is the Manitoba Primary Caregiver Tax Credit, which is unique and doesn't exist in other provinces. It's an annual payment to the caregiver or care partner of $1,400 a year, which comes through the caregiver's income tax. This is not the same as the federal caregiver tax credit, which varies from province to province and which is based on the person who is being cared for as having a very low. And I'm going to also mention, because these are my favorite topics, that medical expenses include a lot more than what we usually think of in terms of medications, physiotherapy, glasses, and private health insurance expenses. The list is much longer. It can potentially include air conditioning, driveways and sidewalks, renovations for mobility and accessibility, attendant care, nursing home, and assisted living care fees. Thank you for letting me make this presentation about the disability tax credit. The thing I hear most from people that contact me is that they either don't know about this or they don't believe they would be eligible. I want to encourage you, because people with pulmonary hypertension receive the disability tax credit approval fairly easily if the relevant information is provided. I have never had a problem with CRA. I find that they're very fair when an application is complete and appropriate for the application form. Thank you very much. It's been a pleasure bringing you this information, which is, again, my favorite topic. If you have questions, you can contact the Pulmonary Hypertension Canada, who can forward the questions to me, or you can join me next week for the roundtable. Thanks very much.
Thanks so much. You know, you're such a wealth of knowledge. I'm so glad you were able to come and join us today. Thank you, Frances. So let's move on to our last speakers. I'll invite Amanda and Rabia to come on the line from Disability Without Poverty. I'll have their slides pulled up and then I'll just read their bios while we do that. So Amanda Lockett is a multitasking mom to a cuddly, energetic, noisy, non-speaking son. She is the BC organizer for Disability Without Poverty and has been with the movement since its inception, helping to create arts events and op-eds. With a background in theater and film, Amanda thrives in an environment of teamwork and advocacy. She holds a double major BA and a master's degree from UBC and a lapsed ABD PhD from U of T. And the other speaker, Rabia Kadir. Rabia is dedicated to equity and justice for persons with disabilities, women, and diverse communities. Rabia most recently served as a director on the Accessibility Standards Canada Board and a commissioner on the Ontario Human Rights Commission. She sits on the Minister's Disability Advisory Group. She is the National Director of Disability Without Poverty and CEO of DEN Support Services. A founder of Race and Disability Canada, she's also a board member of the Muslim Council of Peel and the Federation of Muslim Women. A motivational speaker and documentary commentator, Rabia draws on her lived experience of being blind and advocating for siblings with intellectual disabilities. Rabia has received numerous awards for her humanitarian services, including a Queen Elizabeth II Diamond Jubilee Medal and the Daniel G. Hill Human Rights Award. Rabia holds a Bachelor of Arts from U of T and a Master of Arts from York University. Thank you so much, Amanda and Rabia, and I'll pass it over to you.
Thank you so much for that introduction in its entirety, which is unnecessary. It's our pleasure to join you this morning, this afternoon, whatever time it is across Turtle Island in the space that you occupy. I am speaking to you from Mississauga, Ontario, most recently the territories of the Mississaugas of the New Credit. And in my time zone, it's almost 3:30. So I'm the National Director of Disability Without Poverty. I will jump in and give an overview about the Canada Disability Benefit and disability poverty, where we're at with things. And then Amanda can talk to the more specifics of what's happening in BC. Is that correct, Amanda? Am I accurate? Have I covered it?
Perfect. Yes.
Yes. Okay. And does that meet the webinar host expectations? I hope so.
Absolutely. Thank you.
Excellent. And thank you for the verbal cues. So as a person with a disability, that's my accommodation. I can't focus on hands being raised or comments in the chat box, but I rely on verbal cues. This is the new norm to get used to in online space for somebody who's blind. I'm otherwise speaking to live audiences where I would say, okay, throw things at me, don't just make faces at me, give me sound effects, but that's tricky in virtual space. So let me start the story. The story starts something like this. There was lots of wonderful work done historically, necessitated, unfortunately, because of the reality of disability poverty, the lived experience of people with disabilities who could not find work, could not work due to the barriers they face, or simply did not understand what work is given the nature of their disability. So they're dependent on benefits, and those benefits fall way short of the official poverty lines across this country. There are about 52 official poverty lines, and people with disabilities just found themselves in poverty and poverty and poverty. Advocates, activists came together for decades talking about what's going on, coming up with ways to address disability poverty. And not much progress was made. Maybe one of the most innovative programs introduced was the Registered Disability Savings Plan, again, intended to help in the long term, help people supplement their income upon retirement, quote unquote, or at some point therein when they were living, either earning or not earning money, but would have the option to save some money like any working Canadians who contribute to their registered retirement plans. That was one big step in the right direction. And then nothing for a long time. When the pandemic happened, people with disabilities found themselves in deeper and deeper poverty, worse off than ever before. We were forgotten as a population when it came to the emergency relief benefit. Everybody, including seniors, working Canadians, students, got their payments, and disabled people got it at the very end of the year. Well, somewhere along the way, through the advocacy of people and the championing of Minister Carla Qualtrough, came a promise from the Prime Minister in his throne speech 3 years ago this month, or maybe even this day. In September 2020, Prime Minister Trudeau announced his government's commitment to a Canada Disability Benefit. We began organizing and educating and informing each other and started to mobilize a movement. DWP came to being in September in 2021. We began to do research and offered that research to government to consider in its planning process. We said that the government's made a promise. We cannot trust it to be realized without people power, without disabled people recognizing their power and fully participating in the process. So we championed, and finally C-35, the first Canada Disability Benefit Bill, was introduced. It was quashed, an election was called. We used all kinds of means available to us to raise the voice of people caring about people with disabilities living in poverty and disabled people living in poverty, brought those voices to parliamentarians through open letters, through a petition, through letter writing campaigns, through billboards, through webinars, through op-eds in papers and doing interviews and so on and so forth, and just made the conversation front and center around disability poverty on the poverty agenda and on the disability agenda. Organizations and individuals came together, and finally we had C-22 tabled that moved through Parliament slower than we wanted. Everybody took steps in the system to improve the bill, to protect the rights of people with disabilities to fully participate in the design of the benefit, in creating the benefit. And the bill was made into law at the end of June. C-22 achieved royal assent, and the Canada Disability Benefit Act was realized. The minister changed this summer. A consultation process was announced, and we were all sitting dismayed because we weren't prepared for this change, and we weren't prepared for a consultation process that really did not engage people with the expectations that disabled people had. So Disability Without Poverty now has decided to create its own co-creation parallel process outside of government, funded by philanthropy. We're reaching out for support, and we want to make sure that we hear from people with disabilities living in the deepest poverty who aren't able to necessarily participate in online consultations and whatnot, that we're able to really reach into the grassroots in rural communities, in diverse communities, in northern communities, in the margins of municipalities, and make sure that we hear every voice possible to inform the regulations, policies, and procedures that need to be in place in order to get the money to the people who need it most. So we are pushing for an adequate benefit. People with disabilities across this country live 30 to 40% below the poverty line. A top-up benefit should bring them at least to the poverty line, and poverty does not end with the Canada Disability Benefit. I am glad that people are encouraging people to apply for the disability tax credit, because whether we like it or not, that will be the easiest entry point for government to determine eligibility. We will keep pushing hard for something more so that it's available to more people, that not everybody goes for the DTC, but it's really, really important that people get themselves onto the DTC. We need to make sure that there are no clawbacks by provinces and there are no unforeseen casualties in terms of programs and supports that people get just because they're getting a top-up benefit. The reality right now across the country is that if people with disabilities get a little more income, if they're in subsidized housing, supportive housing, group homes, those rates for room and board or rent rise, and people with disabilities are left again not necessarily better off to cover off their other necessities of daily living and their disability related costs. So the cost of living with a disability is more than the official poverty line. The official poverty line is nowhere near what people receive in terms of a benefit. And people with disabilities keep finding themselves worse off today than they ever were before. If they don't have family members to supplement their income to support them, they find themselves in deeper and deeper poverty. So we have a postcard campaign going. It's important that people who are concerned about the financial security of people with disabilities and people with disabilities themselves engage fully in calling on the finance minister to budget the benefit. We are asking the finance minister to budget at least $10 billion a year for this benefit. Now, we know when you add intersectionality to people's lived experience, they're pushed even further into the margins. So rural Canadians with disabilities, Indigenous people with disabilities, racialized people with disabilities, newcomers and refugees with disabilities, further and further into the margins. Women with disabilities face greater and worse and deepening poverty. So we need to do our part to raise our voice, to leverage the power that we have in a democracy to speak and communicate and express our needs, to push hard for co-creation and have our voices heard through the various channels that are available to us in the government's consultations and the external co-creation consultation engagement process that DWP is going to take on. Now I'll pass it over to Amanda.
Thanks, Rabia. It is always difficult to follow you because you are incredibly thorough, incredibly eloquent, and so knowledgeable in covering so much of what we are trying to do where we are. So just to reiterate some of the points that Rabia has made. For example, you know, the focus on the disability tax credit, the importance we believe of if you are eligible getting on that, because the likelihood is that is the fastest, easiest way for the government to reconcile who is living with a disability and is able to roll it out through that. We are looking at, you know, when Minister Qualtrough was still in charge of the portfolio, one of the things that she had said was really working with provinces and territories to look at how the integration of this benefit would work in terms of being a top-up, being supplemental to, without clawbacks. So there's that piece of it. The other piece regarding the disability tax credit for us, especially as we start this new sort of parallel consultation process, is that you know, there are many people who fall below that ability to achieve the disability tax credit because they're not working enough to pay taxes. So it's, you know, it's all well and good for the government to really be focusing on back to work programs. But we know that there are people who are simply unable to work, and in a, you know, country as wealthy as Canada, those people ought to be taken care of. And I think there is a misunderstanding on behalf of many Canadians that our most vulnerable are taken care of. And we know that they are not. For example, in BC, PWD, the Persons with Disabilities Services amount is, it just got increased. So it's somewhere between 1,400 and 1,600 a month. The poverty line in Vancouver is about 23,000. So there's already almost $1,000 gap between what is expected to be able to live on versus what is being provided. So as we look at this provincial integration, and I can only speak for BC because I'm the BC organizer, we are doing this work across the country in each province. Being able to address the provincial ministers involved and having them understand what a clawback looks like, as Rabia sort of mentioned, will they provide this supplement and then increase housing? Will they provide it and take away the bus pass? A line item can change that can severely impact someone's daily living. They will approve this assistive communication device, but not this one. They'll approve this wheelchair, but not this one. And those are very real world impacts on people with disabilities that bureaucracy as a whole may not necessarily be aware of. So these are the really important issues that we are making sure that the ministers in charge are aware of. Yeah, I'm not necessarily sure what else to say about our BC or our provincial strategy, other than, like Rabia said, getting in and finding the hardest to reach people, the people that the government themselves have admitted they have difficulty reaching, for the Accessibilities Act that was just put together. There were pockets of people that they had said we couldn't get to these people. Those are the voices, those are the people that we are really interested in being able to reach, being able to report, being able to give back to government, because the impact on their lives matters and it cannot be overlooked. So if you'd like to reach out, we are at disabilitywithoutpoverty.ca. We, as Rabia mentioned, we have a postcard campaign. We are happy to get those out to people. They are free to pop in the mail to Minister Freeland because they are going to Parliament. And we have a digital version of that campaign as well that can be found on our website. Sorry, that's my child on his way home. There are many ways to connect with us, to reach out to us, and we are happy to answer any questions or to help facilitate your advocacy in getting your voice heard. Thank you.
Thank you so much, Amanda and Rabia. Your organization is doing such amazing work. I really hope that we in some way can support some of that. If folks are listening today and they want to get involved and they want to support the work that you're doing, or as you mentioned, have their voices heard, if they feel like they're of that minority that are sort of on the extremes and are not being heard, how can they do that?
The best way, if they have access, is to reach out to us through just hello@disabilitywithoutpoverty.
.ca. Yep.
.ca. Thanks. And in addition to that, it's hard to let them know this process, but going through their organizations will be able to reach us as well.
Great.
Yes, and also we do have a toll-free number on our website, and I'm sorry I don't have it memorized, but people can phone us as well and leave us a message and we'll call them back.
Great, we can share that with everybody as a follow-up. And then the postcard campaign as well, we can access electronically through your website as well.
There's an electronic way of sending a message to the finance minister via postcard, but we also have hard copy postcards that we can supply people where possible.
Great. Okay. Thank you so much, Amanda and Rabia. I want to thank all of our presenters today. This takes us to the end of our webinar. It has been recorded, so if you want to watch it back, you can do that, or share it with others in the community. I strongly encourage you to do that. Again, thank you so much for being here, and wish you all a wonderful day. Thank you, everybody. Bye.
Thank you.